Choosing Wisely Committee started as a health system innovation project to implement the Choosing Wisely campaign to help clinicians and patients engage in conversations and make smart and effective choices that ensure high-quality care. The committee is advancing the Choosing Wisely philosophy of reducing unnecessary tests, treatments, and medical procedures. The team identified 7 routinely ordered laboratory tests to limit based on evolving best practices. If performed routinely, these tests could result in redundant or less precise results or false positives. Limiting their use has resulted in a 49% decrease, which has saved time, over $33,000, and worry on the part of our patients. The team is passionate about involving the entire organization and community in implementation. Team members have leveraged the work of Choosing Wisely Canada and have sought input and advice from other early adopters. Information and materials have been shared throughout the hospitals and community to encourage physicians to engage in deeper conversations with their patients about their care requests. The team includes members with varying expertise across the organization, and each takes the lead in different aspects of the work. The emphasis is always on reducing harm and enhancing patient safety by using Choosing Wisely initiatives. The Pressure Injury Implementation Team came together to roll out the RNAO nursing order sets for risk assessment and prevention of pressure ulcers and assessment and management of pressure injuries for the interprofessional team. With the help of the team, Bluewater Health is now the first acute care hospital in Canada to have completed this undertaking, allowing for standardization of pressure injuries organization-wide, enabling nursing staff to provide exceptional care. This team had one vision in mind when becoming pressure injury champions, and that was to better care for Emily and her family. The perspective of nurses who work at the front line is imperative to the success of a project, and the team came with a strong knowledge of the organization and where the gaps were with regards to pressure injuries and who the key stakeholders are that needed to be involved. With enthusiasm for positive change, the team worked hard with the rehabilitation unit to help them understand why the order sets were so important, and after the trial on rehab, they assisted the rollout of Phase 2 and 3 at CEEH and on inpatient surgery, with rollout to the whole hospital in January 2017. Since being tasked by the LHIN with the development of withdrawal management services in 2013, the hospital has hired and trained staff, developed programming, built an evidence-informed business case, and engaged stakeholders, patients, and families. To date, the Withdrawal Management Services team has served over 750 local individuals with drug and alcohol addictions through over 4,500 visits to their day and community programs. Prior to these services, there was not much available in terms of harm reduction-based treatment. Patients seeking help now have treatment options. The team provides culturally competent service, treating each patient as a unique individual. They provide a harm reduction approach to addiction and an open, accessible, and non-judgmental environment where people can change at a manageable pace. The team brings with them a wide array of talents from diverse backgrounds. Knowledge of addictions is at the core, but an assortment of backgrounds gives staff a broader and collective understanding of addiction. Team members are available to the entire hospital and provide information to other staff about withdrawal management programming. The team hosts focus groups with system users and affiliated health groups like public health and rehab facilities, and has improved relationships between Bluewater Health and community partners.